Our objectives for this section are 710, 711, 712, and 713. These will be the sections that will be covered in this part of the lecture. With muscle terminology, they're organized into two groups: axial muscles, which are mostly stabilizers, and then their second group is appendicular muscles, and they're stabilizers or movers of the limbs. Now we're going to highlight some of the key or important muscles. We definitely need to know the trapezius, and then you could see the deltoid, the pectoralis major, the biceps brachii, the flexor carpi radialis, the frontalis muscle, the temporalis, the masseter, the sternocleidomastoid, the rectus abdominis, the extensor carpi radialis, the glute medius, and last, the rectus femoris. Those will all be on the test and on the midterm exam. On the back side, again, we need to know the trapezius, the deltoid, the glute maximus, the bicep femoris, the gastrocnemius, the soleus, and the calcaneal tendon. The axial muscles consist of four muscle groups: the head and neck, 1, the muscles of the spine, 2, the muscles of the trunk, 3, and the pelvic floor, 4. We're going to go through them now. The muscles of the head and neck, the ones you need to know is the orbicularis oris, that's the mouth opening, oris for oral. The buccinator, which compresses the cheek to blow forcefully, that'll be on the test, so will the orbicularis oris. The masseter, which is the prime mover for chewing, the temporalis, which is involved in chewing, and the sternocleidomastoid, which rotates the head or flexes the neck. There are some more muscles, but we're going to skip these on this slide. And now we're going to show you these again from different views. You see your orbicularis oculi, that's around the eye, number 1. The zygomaticus, that's where we smile, that's number 2. The orbicularis oris, that's number 3. The temporalis is number 4. The buccinator, which is not numbered, the masseter, number 5, and the sternocleidomastoid, number 6. We then see also the frontalis from the frontal angle, and again the sternocleidomastoid from the frontal angle, the orbicularis oris from the frontal angle, and the masseter. This is just showing a different angle of the sternocleidomastoid and where it's connected to the clavicle and the sternum. Now this is the table, and the table is highlighted with all the muscles we just talked about, and the important part there is to know the origin, the insertion, and the action. Make sure you look over this table. This is a continuation of the table, and again it's the same format with the origin, the insertion, and the action. Now let's go over the muscles of the spine. There's the splenius capitis and the semispinalis capitis. They work together to extend the head or tilt the head. The erector spinae, which is the spinalis, and the longissimus and the iliocostalis. Know that. This is just the picture illustrating them. Now we go to the muscles of the trunk. We have the internal and external intercostals. They're in between the ribs. Make sure you know that. That's on the midterm. It's on the final. Your diaphragm is used for inhalation of breath. Your external and internal obliques and the transverse abdominis, that helps us compress the abdomen and flex the spine. And then your rectus abdominis, that's how we get our abs, and it depresses the ribs and flexes the spine. This is just the image showing you those, and they're highlighted. Now we go to the muscles of the pelvic floor. This is very important. Sometimes women and men will have issues with the pelvic floor, and they can have a collapsed bladder. The perineum supports the organs of the pelvic cavity, and it's a very important muscle to protect. Here's the image of that for the male and female. Now we're moving on to the appendicular muscles. The appendicular muscles have 6 major areas. The muscles that position the pectoral girdle, the chest area, the muscles that move the arm, forearm, and wrist, the muscles that move the hand and fingers, the muscles that move the pelvic girdle, the muscles that move the thigh and leg, and the muscles that move the foot and toes. Again, here's the list of muscles and their functions. Again, know the trapezius, a diamond-shaped muscle in the back. The rhomboids adducts and rotates the scapula laterally. The serratus anterior abducts and rotates the scapula. And then remember that we're going to say the pectoralis minor and pectoralis major. The pectoralis minor and subclavius depress and abduct the shoulder. This is the illustration of those. Now, let's move on to the arm. Make sure you know the deltoid, that abducts or abducts the arm, the subscapularis, teres major, and infraspinatus, and teres minor, and they form the rotator cuff. Make sure you know that. The pectoralis major flexes the arm at the shoulder, and the latissimus dorsi extends the arm at the shoulder. Again, here's an image showing that. Next, we move on to the muscles of the forearm and wrist. We have the biceps brachii, which flexes the elbow and supinates the forearm. The triceps brachii, which extends the elbow. The flexor carpi ulnaris flex the wrist, and the extensor carpi radialis extend the wrist. These will move the muscles that move the hand are the extensor digitorum that extends the fingers. The flexor digitorum flexes the fingers. Of course, the abductor pollicis abducts the thumb, and the extensor pollicis extends the thumb. Again, here are the images and the highlighted muscles. Now we go to the muscles of the thigh. The gluteal group includes the gluteus maximus, that's the largest, most posterior muscle, and it's a hip extensor. The adductors are a group of muscles, the adductor magnus, adductor brevis, adductor longus, pectineus, and gracilis. They adduct the leg. And then the largest hip flexor is the iliopsoas. It's the psoas major and the iliacus. Again, this is the image to illustrate where these muscles are. Now, this is a table that describes the muscles with the same format of origin, insertion, and action. Make sure you look and learn the highlighted muscles. Let's go on to the muscles that move the leg. The knee flexors or the hamstrings. They include the bicep femoris, semimembranosus, semitendinosus, and sartorius. And then the knee extensors are the quadricep femoris, which include the rectus femoris and the 3 vastus muscles. The vastus medialis, vastus intermedius, and vastus lateralis. And the popliteus muscle unlocks the knee joint. Again, here's the image where those muscles are highlighted. Make sure you can identify those muscles for the test. Now let's move on to the muscles of the foot and toes. The gastrocnemius of the calf is assisted by the underlining soleus. They share the common calcaneal tendon and are both plantar flexors. The tibialis cause inversion of the foot, and the tibialis anterior is the largest and produces dorsiflexion. Again, we have the image here of the leg, and you see the muscles identified. Make sure you can identify these muscles. This is a side view of the lower leg showing the gastrocnemius and the soleus, the tibialis anterior, and the calcaneal tendon. This is the image from the different angle from the inside. Again, looking at the tibialis anterior, gastrocnemius, soleus, tibialis posterior, and the calcaneal tendon. Now, what are the aging effects on the skeletal muscle? 1, muscle fibers become smaller in diameter. 2, they become less elastic and more fibrous. 3, their tolerance for exercise decreases due to a decrease in thermoregulation. And 4, their ability to recover from injury is decreased. Finally, Exercise engages multiple systems. For the cardiovascular system, it increases the heart rate and speeds up the delivery of oxygen to the whole body. For the respiratory system, it increases the rate and depth of respiration. For the integumentary system, it increases dilation of the blood vessels and sweating, and they combine to increase cooling. And finally, the nervous and endocrine system work together to control the heart rate, respiratory rate, and release stored energy.